With the ongoing surge in COVID cases, we were curious what the impact is on some of our local hospitals right now. Channel 2's Ron Plants is getting information from ECMC as we wait for more information from the Kaleida and Catholic health systems. We learned today that COVID is also taking a toll on hospital staffers at ECMC.
It's our regional trauma center, and just like everyone else these days, ECMC is feeling the trauma of COVID cases hitting the healthcare and support staffers who save lives and try to help heal and cure those who are afflicted with all types of ailments, not just COVID.
I've been concerned all along that we were going to have large numbers of staff out at a time when we already are missing a bunch of staff because of retirements and people leaving to take other jobs.
Last week, hospital officials report that over 200 of the ECMC workforce of 3,800 were out with COVID infections. And this week, it's about 171 calling out with COVID.
The CDC guideline change where you can come back to work at 5 days if your symptoms are better has been very helpful to get our staff back to work. But it is still a major problem to have 171 people out of work right now.
And the number of actual COVID cases they're treating has climbed right in parallel with their absences. ECMC now treating 120 COVID patients. That's compared to 75 at their height in 2021, and then 78 patients just 6 weeks ago. The only good news in their hospitalization situation is the use of the intensive care unit for very sick patients.
The ICU utilization is definitely much less during this wave, and that's probably a combination of more and more people being vaccinated and boosted. And Omicron does seem to affect the lungs a little bit less than previous iterations of the virus.
Coming up at 5 and 6, we'll take a closer look at COVID cases at ECMC, whether they were admitted strictly as COVID cases or for something else. Ron Plants, Channel 2 News.